Hello, friends. Welcome to Parkinson's EmPower Talks, a journey of empowerment and understanding for living your best life with Parkinson's. Kick back, relax, and get comfortable. We're here to make your Parkinson's journey just a little bit easier. I'm your host, Dacy Reimer. I'm a nurse practitioner specialized in movement disorders and the director of medical advising and education for the Wisconsin Parkinson Association. The Wisconsin Parkinson Association's mission is to provide hope, community, support, and resources for people with Parkinson's and their loved ones. Hello, and welcome to Parkinson's EmPower Talks. My guest today is Dr. Kathryn Gaines, who is a movement disorder specialist with Aurora Healthcare. Dr. Gaines, thank you for joining me. I appreciate it.
Thank you for having me.
Now, you are also a distinguished member of our medical advisory committee for the Wisconsin Parkinson Association, so I thank you always for your time on that. And what I wanted to ask you first before we get into our topic on Freezing Gait is give me a little bit of background on how you got into movement disorders and like where your practice locations are so people can find you.
Okay. So I am at the Aurora Good Hope Clinic in Milwaukee. I have been here for about 14 years, which I cannot believe. So I came to this location straight out of fellowship, which happened to be in Charleston, South Carolina. So came in the opposite direction that people normally go, from south to north. But I'm a Midwesterner at heart, so I wanted to come back to the snow, believe it or not.
My husband's there right now, actually, for business.
Oh, really?
So
In
coming
Charleston?
back, yeah, in Charleston. Yeah. Interesting.
Yeah, so it was nice there, but I'm glad to be back in the Midwest.
Are you good? Fantastic.
So
Well, we're glad you're here. So, and then is that your only practice location? Do you always stay at the same location?
I do. I do take call at the Aurora Grafton Hospital, but as far as outpatient practice and seeing movement disorder patients, I'm just exclusively at the Good Hope Clinic.
Super. Fantastic. Well, thank you for that. Our topic today is a phenomenon called freezing gait, and that's something that not everybody obviously experiences, but those that do know it, but might not know really what it's called, and those that don't necessarily have it or have it diagnosed might not know what we're talking about at all. So, what is this phenomenon that we call freezing gait?
So freezing gait is really the inability to move your feet forward with the intent that you want to move them. So if you want to walk and your feet just aren't cooperating, so they might feel like they're stuck to the floor, like they're glued to the floor. Feet might feel heavy, or they might have a gait that's really distorted, where they have very, very tiny steps that they are making instead of a full length stride. So that's freezing of gait.
And do we know why it happens? Like, physiologically, like why does that happen to some people and not happen to others?
We do not have a real good understanding of exactly why it happens. Walking in general is a very complex task that involves different aspects of the brain and also the spinal cord. And we know that, and it's not in everyone, but there's certain areas of the brain that are affected with Parkinson's more so in that individual person. And so they can get freezing of gait because that area is affected. But basically, so the areas that are involved in gait in general include the frontal areas of the brain, include the middle area of the brain where the basal ganglia lives, which is responsible for a lot of coordination of movement, the back of the brain with the cerebellum, and then the brainstem, which is just the transition from the brain down to the spinal cord, and then the spinal cord itself. So all of those different areas are, in play, and they have to be well coordinated to have good stride length and coordinate posture. So it's pretty complex.
It sure is. So with this phenomenon of freezing gait, kind of who gets it, or does everybody get it, or are there only some people that get it?
So not everyone gets it.
Mm.
I would say that people who have advanced Parkinson's are more at risk for having freezing of gait. I think the statistics I've seen kind of vary as far as, the prevalence.
Mm.
But I think in my practice in particular, just to kind of give an idea with the advanced Parkinson's population, probably half or more have freezing of gait.
Mm.
And we do know that there can be some risk factors to developing freezing of gait. But again, those risk factors aren't exclusive to each or universal to each individual. So
Mm.
some may have those risk factors, some may have none, and yet they still have freezing of gait.
Mhm. And what are some of those risk factors for people?
So aside from advanced Parkinson's,
Mhm.
sometimes there's medications that are inadvertently causing some issues with freezing of gait. Anxiety tends to be sometimes an issue. People with cognitive impairment, that can be an issue. There's an association with freezing of gait and REM behavior disorder.
Mhm.
Um, and then also just the aging brain in general. So there's something called white matter disease, where you can get little spots in the brain that appear white on something like an MRI. And that's just from the aging process. But if you get enough of those, they can coalesce into a larger area and then, can affect those areas that contribute to gait and then cause the freezing of gait too.
Mhm. Very good. Thank you. And you mentioned, that not everybody gets it, but definitely can affect their balance. And so this sounds like it can be pretty dangerous.
Can be dangerous.
Yeah.
Um, the freezing gait in and of itself to the individual is not threatening, but the repercussions of the freezing of gait can certainly be dangerous. It puts them at a higher risk of falling.
Mhm.
So injuries and trauma can definitely be risk.
Yeah, definitely. I definitely feel like when you're dealing with advanced Parkinson's, and even if a person's at a facility, it's something that's very misunderstood, and that even other caregivers who are maybe paid caregivers have a difficulty really understanding it and how to manage it,
Mhm,
and get people where they need to go safely. And the
mhm,
first instinct is to just have them sit down, and not get up and walk at all, and just kind of keep them in place. So
mhm,
and that's not what we want, of course. We don't want people to have to stay put. We want people to move and exercise, but um, giving the danger, that tends to be kind of that first instinct that people
mhm.
have. So you mentioned, about some of those factors that are there. What about anxiety? Like, tell us a little bit more about how that factors in and what that looks like, how
Mhm.
that presents with freezing gait.
Yeah, so we know that the limbic system, which is the system that sort of regulates our emotions,
Mhm.
is involved with the gait mechanism. Um, and so, if you have anxiety or depression, actually, that can affect your walking ability.
Mhm.
However, of course, people who have freezing of gait become more and more anxious, especially if they have to go out into the public. They don't want people to see them having freezing of gait. They don't want to be in a position where, they might fall in
Right.
public. So,
That fear of falling in general, you could
absolutely.
fall, or that fear of falling. Mhm.
So that kind of keeps them limited in as far as being able to venture out into public. And then if you're in a crowd, for example, or if you're in a busy area, if there's a lot of clutter around, if it's in the house or if it's outside the home, if there's a lot of people around, those are almost like obstacles for them to try and
Mhm.
maneuver around. So that is also an issue when it comes to freezing. Those sort of things make it worse. But for example, getting on an elevator, you have to get on an elevator at a certain amount of time before the doors close. If you have freezing of gait, that task is just so hard because in the back of your mind, okay, I got to get going. I got to do it now. I got to get through there.
Right.
And that makes some anxiety. So I see that, quite a bit. So it's things like
When
that.
I was working in Milwaukee, I had one woman in particular who would come in, and we were on the third floor. And so she had to get on the elevators, like you had mentioned, and the doors want to move and the floor is moving, and it's just unstable. And so I would have to go down and get her downstairs and bring her onto the elevator. And then there was a time in the clinic where her boyfriend came with and said, "Oh, well, we go out dancing all the time." And I said, "Dancing, she has a hard time walking. I can't imagine." And he says, "Well, she loves Elvis music. So if you just give her some Elvis music, she can really get going." And so that was, I'm dating myself. That was back in MP3, the MP3 player era. And so she would now then put her MP3 player on and some headphones, and she would dance her way up to the visit on the elevator. And she could do it then. But it was really just taking her fear away, or that anxiety of those doors closing and things. And that was kind of her new way of getting places that she had all that anxiety and that fear was Elvis. Elvis got her through. So when you said that about the elevators, it kind of struck that memory for me. What about so caregivers? Recently, I was on a caregiver. We have a virtual caregiver program, and on that topic of anxiety, I was mentioning that sometimes you can tell in those clinic visits a little bit about even that relationship with their significant other, because if they're freezing and that person is going, "Hurry," kind of giving you the vibes, or touches your shoulder and goes, "Hurry up, you're embarrassing me," that person freezes more, as opposed to a reassuring touch that means, "Don't worry about everybody else. We'll get through the grocery line." And then the freezing gets better. That tell us a little bit more about like what that kind of that light switch effect is with freezing and anxiety.
Yeah. So with the anxiety, like I said before, if the anxiety is really ramped up somehow, that really interferes with the gait mechanism. And so you mentioned, for example, your patient who, could seems like she would walk better with a certain music or sound.
Right.
And what happens with that type of technique is not only is it soothing for them, but it also sort of accesses a different pattern in their brain. It kind of circumvents that freezing circuit. And if somebody has a technique like that, and they know, okay, this technique really, it seems to work pretty well, it's pretty reliable, they can have that in their back pocket when they go out. So somebody who's next to them who can, kind of comfort them, give them a soothing encouragement or a touch, that also acts in a similar way, especially if it's something that they know, okay, I have this person next to me. It's always something that they're soothing or comforting me. It's reassuring to them, that helps with the emotion aspect.
Mhm.
So,
I think one of the biggest fears is being stuck in a situation where you can't get out, and even just having that loved one or the caregiver next to you, that is a reassurance, and oftentimes just having them there helps them overcome that. Yeah. What about, you mentioned also about the effect of cognition, and kind of there's an interplay there, cognition and that freezing gait. Tell us a little bit more about that.
yeah. So, as I mentioned earlier, so part of the brain that helps regulate walking, a major part of it is the front of the brain, and that's part of the area of the brain where that controls some of our decision making, our executive function, it's called.
Mhm.
And it's kind of the area where the initial thought of walking kind of is born.
Mhm.
And it's also one of the areas that happens to be affected early on for some people with Parkinson's when it also causes cognitive issues.
Sure.
So it happens to be that's also the area that you can implicate as well as the freezing of gait.
Mhm.
So
Is it related? Is that something that people are worried about then, is cognition, if they have freezing gait, and that they're going to have an impairment in cognitive function too, or is that not necessarily correlated?
It's not 100% correlated. We see cognitive issues in a large population, a large amount of Parkinson's patients. But whether we can implicate, that cognitive deficit for them for their freezing gait, it's hard to say for sure. Cognition is always something that we need to evaluate every time somebody comes in for Parkinson's disease. And it happens that even if there, maybe some minor cognitive issues, we may not even be able to pinpoint it as, something Parkinson's related.
Right.
If there's freezing of gait, one of the medications that we can sometimes use is actually medication that has also been known to help with memory. So
and that would be my next question is like, how do you treat it? Like, if somebody comes to you in your clinic with and has freezing gait, what do you do for them? Maybe how do you test for it, or what kind of tests do you do, and then how do you treat it?
So part of my process with follow-up visits and consult visits, I always have to see them walking, and it's usually down, sort of a long hallway. And in fact, most people, and you probably have seen this too, when they're out in the hallway, they do much better. And even much better in the clinic versus at home.
Right.
But the trick is getting out the door, which is usually, it's kind of narrow, getting over the threshold. So we might see some freezing there. We might also see some freezing when they get down the hallway and they turn back around. So part of the freezing can be involved with the turning. So, it's monitored with each visit. And so, if you see freezing, you ask them also, how much of your day do you think you have freezing? What is the percentage like? When does it happen? Does it happen in the morning usually? Is there a pattern to it? Does it happen in the evening? Does it feel like it happens when your medication wears off? Does it happen randomly? Does it happen more when you're anxious? So you try and find a pattern to when it happens, and then you address that specific, potential trigger. Sometimes it's part of the wearing off. Sometimes it is other medications, like I mentioned before, that we can kind of implicate. And if you look at those things and that doesn't seem to be, one of the triggers, or you don't think it is, then, you look at other potential options you can add on as far as medications go. And then there's other things. Physical therapy is huge as far as a remedy for freezing of gait. And it's a matter of teaching proper mechanics, and then also reinforcing those mechanics at home with practicing those exercises you learn. During physical therapy, you can sometimes learn some of the tricks that kind of help trick your brain out of that freezing mode. And practicing those at home as well. So it's a combination of things.
There's a lot of psychology to it. Yeah. And so you mentioned, that with the freezing gait that, you mentioned some about timing. So it's really important, obviously, for them to pay attention to maybe logging some of those symptoms. If it's, you notice it in the morning, like you mentioned, with what we call early morning akinesia, meaning you're slow in the morning, and that's a slow time. Maybe the meds haven't kicked in yet, or if it seems like it's wearing off, meds are wearing off. So those are important things for them to kind of jot down and know and pay attention to, because I think a lot of times when that happens, it's just frustrating, and they can't, there's no real rhyme or reason, or at least they think there's no real rhyme or reason, but it might have to do with the ebb and the flow of their medication. So it sounds like it's important for them to kind of try to document, or at least assess that piece, as opposed to, hey, I take my medications, and no matter what, I still freeze. So those are good bits of information for them to log for you.
Yeah. And you made me think of also the other important piece of that is also the caregiver that might see patterns that the patient doesn't necessarily recognize. So they can also give pretty good clues when they see something that is really consistent and presenting itself.
Yeah, definitely. It can be really disabling for people. I mean, they get out in public. In an episode, I had one fellow who it happened where he froze up in church, and they ended up calling 911 to get him out of church. And then he wouldn't go back. He just wasn't going to go back again to try to see if that, wasn't going to happen next time. So it can be really socially isolating for people if they then don't want to get out in public, and that's definitely not what we want. So, what are some of the tips that you give your patients to helping to overcome those freezing
Mhm.
episodes?
Yeah. So first of all, we kind of touched on it with their medications.
Mhm.
Make sure that they're doing their absolute best with getting their medications in on time,
Mhm.
noting when the freezing of gait happens, so we have more clues of how to kind of adjust the medications in the
Right.
future. Making sure that they're doing their physical therapy exercises, that hopefully, they've gone to physical therapy for this, they've learned some techniques and discovered some tricks to help them through. Sometimes using a device like a walker, you can get a walker that has a laser on it. The laser will make a line on the floor appear, and it's kind of tricking the brain into thinking, okay, instead of walking forward, I have to step over. So this sort of circumvents the walking motion, and the patient can step over something as opposed to walk straight through something. So it's things like that. I've had, like you, I have patients who, can't walk 5 feet. They might have a freezing of gait, but they can walk up and down stairs all day long, or they can ride their bike, or they can go, dancing or a certain song. So, knowing that, they're able to do that can also help.
Mhm.
Um, but yeah, it's managing a lot of different moving parts.
Mhm. And you mentioned the walker with the laser light, and there's also a laser cane that
Mhm.
people can use that has a laser light. And then there's also the U-step walker also has that metronome that's keeps a beat, and that's kind of one of the methods I definitely try to teach people is music, whatever your favorite music is. I had one fellow from Baraboo who was a music teacher, and so he would listen to big band music that really had a beat to it,
Mhm.
and that really worked for him really well for overcoming that freezing gait. So
Mhm.
and one person told me they listened to another one bites the dust or they sing it in their head. And it was a boom, boom, boom. And that rhythm just got them going. And I think realistically, it kind of made them laugh too. The fact that it just kind of took that anxiety down, that they know when they either
Right.
sing that song out loud or they play it in their head, it
Yeah.
kind of puts them at a little bit more ease and that
Ease
anxiety decreases
attention.
too. Yeah.
Yeah.
Interesting. So, what about caregivers? Like, how can they help? If a person's freezing, what do they do? They're usually standing by feeling helpless.
Mhm.
Is there anything else that they can do?
So, I mean, one thing that they want to do is make sure that they're not inadvertently or even intentionally sort of rushing them.
Right.
You don't want to put that pressure on them.
Mhm.
And then they can remind the patient, okay, well, you've been through this before. This is what worked before. Let's try this
Mhm.
different techniques, or let's try the exercises that you learned through physical
Right.
therapy that helped. So they can be a reassurance. They can be somebody who, reminds them, okay, let's just slow down a bit. Let's try these things
Mhm.
and let's overcome, the freezing of gait.
Right. And sometimes that's the problem is their feet are kind of stuck and their upper body's still or they're trying to move them forward as opposed to just kind of saying, okay, let's just take a couple of deep breaths and then a big step and kind of that person being the person to reset them.
Reset them.
Yeah,
Yeah, the
fantastic.
reset.
Because that is a very helpless feeling when you know somebody is really at risk for falls and you can't really do anything to help them overcome that. So, and then you mentioned some about like therapy and exercise, and tell us a little bit more about that because I agree with you completely that that is key to helping to overcome that. And is that something that caregivers can participate in too so that they can help learn it?
Yeah, absolutely. So in my patient population, I do try and get patients into physical therapy on a recurring basis.
Mhm.
It may not be every 6 months, maybe once a year. It really just depends. But I do want to make sure that they are seeing a therapy specialist who specializes in Parkinson's.
Mhm.
They're teaching them techniques and also body mechanics that kind of reinforce the proper gait. And then they have to take those exercises that they learn home and definitely do them. A lot of us like to, at first we're really gung ho. Okay, we learned these things. We're going to keep exercising, and then it just kind of peters out after a while. Something sort of interrupts their routine, or they maybe, it's holidays, like holidays are coming up. They just really have to be,
Can't fall
um,
off the wagon. Yeah.
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 So, they have to be dedicated to
Mhm.
to those exercises. I think that's the most helpful and probably the most challenging too, is just to keep up with those routines.
Yeah. I usually kind of preface when I would ever prescribe therapy to remind people that the therapist isn't going to do it for them, that they're there to learn the technique and kind of go into it with that headspace so that they're knowing that they have to keep up with it and then try to work themselves into a community program.
Mhm.
That's the first step, is just kind of overcoming. Maybe there's been some falls and now they've really lost that self-confidence and now getting it back. Or maybe, like you said, they've had therapies, but they need a refresher course. But knowing that it's so important, and most people can kind of see that they do decline when they're not even, they don't keep it up at home or don't get into a community program.
Mhm.
Yeah, super important. So we kind of talked a little bit. We talked about what information was already important, like logging. How do you have your patients give you feedback on information? Is it something you have them keep a log or put things on the calendar, or just kind of have them all kind of note to self so that you can have that discussion and figure it out?
Yeah, so it depends on the person. If it's somebody that's I think that can keep a log on a regular basis, and if it's something that's useful to them, it also is, keeping a log is kind of like, something that they feel that's tactile that they're doing that they can bring to me.
Right.
Otherwise, there are patients who, don't really have as much insight about it, especially if it's something where they're having some cognitive struggles too. So we just have to kind of play it and just understand how it affects them as much as we can. And that's where, the caregiver also comes into play too.
Mhm. Right. And you mentioned before about talking to caregiver too about like decluttering space, and you mentioned too about that visual input and how important it is. So talk a little bit more about that, what they can do with their homes, as far as making any changes that could potentially help. Is there something
Mhm.
like with lighting or decluttering and flooring and things like that? Are there things that they can do that they could potentially reduce that freezing episode?
Yes.
Mm.
So yeah, you mentioned flooring.
Mhm.
A lot of people who have freezing gait, they might have it as they transition from one texture of flooring or
Mhm.
pattern to another. So if there's any way they can sort of make a uniform flooring,
Mhm.
and then, of course, get rid of, thick rugs that might, catch them up, their feet get
Mhm.
kind of stuck in those. And if there's a lot of furniture around that makes them have to navigate,
Yeah. Yeah.
yeah, some obstacles, if that can be simplified, if there's
Right.
things that aren't necessarily needed anymore, they can be put to the side, so there's sort of like a wider space for them to go through. And I also think that sometimes when, people at home, they have a lot of freezing of gait at home, but then sometimes they don't have as much freezing of gait out and about or at somebody else's house. They might not have, as much freezing of gait. And I think it's about the pattern that they are used to at home. So even changing the pattern of where they have to go around, furniture to get from point A to point B, maybe changing
Mhm.
the furniture pattern a little bit, but yet still keeping an open space.
Right. That's a good point. I
So, and
haven't
then
thought of that.
lighting, like as you said, lighting is helpful, something that
Mhm.
you want things bright, you want their vision to be optimized because
Right.
we know that if the vision is impaired and if it's peripheral vision especially, that also contributes to that feeling of freezing of gait.
Excellent. Thank you. Appreciate all those insights. Everybody's always looking for, what can I do to try to improve it in the home? And definitely the freer the space that I always say, body in motion stays in motion. The more you have to make that person start and stop, and with clutter or turning and things, it's definitely going to make them hesitate more. So thank you for that. What about research? So what's the future with this? Is there much for research going on? Because it is such a strange phenomenon.
Absolutely. There is a lot of research. They're doing research with certain areas of stimulation with patients who might be a DBS candidate or have DBS, which is deep brain stimulation. They've been doing research about certain types of stimulation externally. So transcranial magnetic stimulation has been in the research mix. Even spinal cord stimulation has been looked at. They're looking at biomarkers. They're trying to understand more just about the physiology behind freezing of gait. So that, if they can pinpoint it better and understand it better, of course, what can they do in the future to prevent it? They're looking at soft exoskeletons where you actually wear something that actually moves your legs for you, and genetic testing as well. We're trying to really understand what's involved genetic wise in people with Parkinson's. Is there freezing of gait factors there? So, but there's definitely a lot of research about it.
Mm-hmm. Very good. That's at least exciting to know that that's being looked at and encouraging, I'm sure, for the people who are experiencing it. Yeah. Anything else that you feel we didn't cover as far as any of the topic on freezing gait?
I think covered the major topics.
Yes. Okay. So
yeah.
if you were to give our listeners one piece of empowering advice about freezing gait, what would that be?
Well, it's probably, it's not directly medical, but I would say keeping a sense of hope. Freezing of gait is probably one of the leading factors regarding Parkinson's that affects quality of life.
Absolutely.
And having a positive attitude, being more cultivating the optimism is going to directly improve quality of life, regardless whether you have freezing of gait or not. That's shown to be the case. But as we mentioned, there's lots of research going on. So being hopeful for the research that they're going to, uncover something that's really going to help with the freezing of gait. And then having, gratitude for what is working and having gratitude for those small wins from day to day, that boosts the hope. You just really have to have hope. You look from one day to the next, and the hope is a big driver for a lot of people.
Right.
So you can foster that always. Then I think you're in good shape.
Good advice for all of us. I appreciate you being with me today. We all appreciate your insights into freezing gait, and thank you so much for taking the time out.
Well, thank you for having me.
Absolutely.
Hopefully it's been helpful.
It has been.
Great.
Take care now. The Wisconsin Parkinson Association is a grassroots organization funded by people like you. To support more local programming like this, visit wiparkinson.org.